Hi, everybody. Welcome. Let's talk about the big takeaways from this chapter on substance use disorders, substance abuse, and substance dependence. First big takeaway, it's again essential that you remind yourself that normal and abnormal are on the same continuum of human experience, and that applies to the behaviors called substance abuse and substance dependence. Because we recognize that just about everyone at some point in their life experiments with substances. Getting hammered or alcohol that's used as a part of partying back in college or wherever. We recognize that as part of certain phases of life for many people who otherwise did not end up with any behavior approaching a diagnosable distress or dysfunction. Alcohol may have just sort of been a part of their life during a certain phase, college or some time of their life. It is common to find mild forms of these substance abuse behaviors, the symptoms, in people that we know, including ourselves for that matter. Just remember that the disorder comes in the extremes of intensity. They use a lot of the substance and they use it for long periods of time. That's what's different about normal versus abnormal substance use. The second big takeaway, it is interesting clinical folklore that we try to estimate a new client's underlying mental state by noting their routine drug of choice. It is human nature, of course, to restore equilibrium whenever we feel discomfort. If you're in a room and it's really hot, you want to cool off. If you're in a room and it's really cold, you want to warm up, right? You want to restore equilibrium so that you're in a comfortable state. So it follows that the anxious will seek to calm themselves, the depressed will seek to elevate their mood, and the overwhelmed will seek to just escape. So when we ask the question to a possible substance user, when the routine drug of choice is a stimulant, an upper like cocaine, we estimate the user may be attempting to escape their default normal mental state of feeling down, feeling low, feeling sad. So they take the upper to bring themselves up out of this low state. When the drug of choice is a depressant, a downer like alcohol, we estimate the user may want to escape their feeling of their default of feeling anxious, their default state, their normal mental state. They feel anxious, they're tense, they're irritable, and the alcohol helps them calm down. If we find the drug of choice is hallucinogens like LSD, we estimate that the user may just want to simply escape the current situation completely. But note that this is just some interesting clinical folklore that we use to try to estimate a new client's underlying mental state by asking about their routine drug of choice. Most people have a favorite drug that they go back to over and over. We'd call that a drug of choice. So in summary, it's again essential to remind yourself that normal and abnormal are on the same continuum of human experience, and that absolutely applies here to the behavior called substance abuse and substance dependence. Secondly, it's interesting clinical folklore that we try to estimate an underlying personality, an underlying mental state by noting the routine drug of choice. Because it is human nature to want to restore equilibrium when we feel some kind of discomfort, and they may seek the drug to restore that sense of equilibrium. Those are the big takeaways from this chapter on substance use disorders. Thanks, everybody.